Thank you very much. So I'm really excited that there have been so many talks about education at this conference, and that there was a really great meeting last night for the Education and Outreach Committee, because I came to this conference in part because I've been thinking about the education of evolutionary concepts in public health programs for a while now. And I was hoping to get a chance to meet many of you that also have feelings and experiences to share on this topic. So what I'd like to address for my talk today is explicitly how it is that we can get these evolutionary concepts in at the undergraduate level in these new exploding baccalaureate programs in public health that are increasing in representation around the United States, so that we can then seed those classes in medical schools, in NPH programs, and ultimately those populations of future physicians and public health professionals with these evolutionary insights. We all know in this room that evolutionary insights do not always make it into public health practice, education, and research. We see this through the persistence of the body as machine analogy that we see in graduate medical training. We see this through the use of lithotomy and other approaches in maternity care that do not accord to the evolutionary history of the mother-infant dyad and how human females have evolved to optimally give birth. And we see it through a series of well-meaning health communication campaigns that belie a fundamental misunderstanding or a lack of understanding of the evolution of human health and behavior, such as this campaign from the Milwaukee Department of Health that insinuates that a baby sleeping beside its mother is no more safe than a baby that has been put in bed beside a carving knife. So there's two primary strategies that I see for addressing these problems as a public health professional myself. One is through the integration of greater evolutionary training and evolutionary insights in the training of future physicians, future public health professionals, and so forth. And the second is through informing directly those health communications campaigns, healthcare providers, social workers, and policymakers with these evolutionary insights through our outreach as evolutionary scientists who have an interest in health. I believe very much that both of these are essential. However, for this talk, I'll focus on the first of these propositions to try to increase this through training, because I feel that if we do a good enough, and in fact a broad enough job in this, then the second problem largely takes care of itself by having those insights seeded into the people that in many cases will be those future policymakers and message shapers. So as a foundational question, we can look at what's happening in graduate training now and the extent to which administrators of public health programs and deans of medical schools are aware of and value the insights that evolutionary medicine can provide for people who will have practicing roles in these fields. In the Nessie and Schiffman 2003 study that you've heard about in several talks already this conference, we've learned essentially that fewer than half of deans of medical schools said that evolutionary medicine or evolutionary biology was considered important information for physicians to learn. We learned yesterday through a paper presented by Mark Schwartz and published, I believe, last week by Hadaka et al., that there has been an improvement generally over the past decade in the representation of evolutionary concepts in graduate medical training and a greater awareness by deans of the importance of these, yet there is still work to be done. 2 years ago, a student of mine, Kaylee Cliff, and I also conducted a study where we used a very similar methodology, but we instead looked at deans of schools of public health and other administrators for graduate public health programs that were not housed within a formal school of public health. And what we found there was that, again, only about half of those key administrators agreed with the importance of teaching these evolutionary concepts to future public health professionals, meaning, of course, that half did not view this as important knowledge for public health professionals to have. Furthermore, if we look at the specific topics and what gets taught in these different settings for graduate training in either public health or medicine, we see that there is a similar gulf between some of those topics that tend to get taught at greater frequency, such as antibiotic resistance, which was taught in nearly all of the medical schools surveyed in both of the 2003 and more recent studies, and virulence evolution, but where those are represented at much lower rates in schools of public health, where, for example, in my study that I conducted with my students, only 2/3 of our surveyed deans and administrators indicated that antibiotic resistance was an important topic to be taught in public health schools, and less than half agreed that the evolution of virulence was a relevant topic to be taught. When I look instead at those other topics within the subset of about a dozen across these 3 studies that looked at evolutionary concepts that could be taught, and that we would argue, I think, should be taught in medical training or in public health training, I found that even though there was an increase in the teaching of design flaws from path dependence and looking at proximate versus ultimate explanations from 2003 to the article that was published this year in medical schools in the United States, I don't see evidence of that same potential increase in my more recent study, the 2013 study of public health programs. Of course, I don't have a representation from 10 years previous to compare that to, but we are still seeing that public health programs are perhaps lagging behind medical schools at integrating these evolutionary insights. In particular, in my study with my student, we looked at what might be impediments to increasing the representation of evolutionary concepts in graduate programs in public health. We asked this question in part feeling that perhaps political controversy, maybe emanating from the idea of religious objections, might stymie deans' abilities to encourage evolutionary teaching, or perhaps that there might be a lack of agreement in the importance of these topics, but overwhelmingly that wasn't the case. The majority of deans indicated that the 2 significant impediments to increasing the teaching of evolutionary concepts in public health programs was the lack of time in the curriculum to fit these concepts in, and the lack of faculty expertise. Indeed, among the deans that responded to my survey, none of them had programs that had an evolutionary anthropologist or an evolutionary psychologist on faculty, and only 3 had an evolutionary biologist or a faculty member whose background was in ecology and evolution on the faculty. 2 other concerns emanated from that study, which were that the deans were largely concerned about accreditation and whether accreditation would cause a problem for the integration of greater evolutionary teaching in public health programs. And further, the expectation that these students have had it all in undergrad already, that there's no need to fit in these evolutionary insights in a graduate public health program because students would have already been exposed to that during their college years. However, there is not a systematic series of prerequisites for MPH programs in the same sense that there is for medical school, and the background of students in public health programs will vary dramatically. So this got me thinking about the question of undergraduates. This idea that undergraduates are a sponge, in fact, that can soak up new ideas and new theoretical approaches and then use those as the framework to explore all sorts of other topics. This idea that undergraduates come to college after a relatively rigid high school curriculum that constrains what things they can and are required to study, and then have a whole wealth of courses through the arts and sciences, the health professions, business, engineering, and so forth from which to choose. And I also began thinking about undergraduates in this context as a person who has spent the past almost 3 years teaching exclusively undergraduate students in public health majors that then are going to hope to go on to careers of impacting health in a wide variety of ways. Many of whom hope to be physicians, but a number of whom are planning to become hospital administrators or people that work in health journalism or health communication, physical therapists, nurses, and so forth. The Association of Schools and Programs of Public Health has recognized these increasing opportunities to influence undergraduates with insights into public health broadly. Not evolutionary insights, of course, specifically, but has commented upon the fact that there are these increasing opportunities for undergraduates to attain a foundational education in the field that they're then going to put forward in going into graduate training in one of the health professions, or beginning to enter the workforce in ways that will intersect with public health or public policy. And there has been this significant increase in the number of undergraduate public health degrees conferred. In a time period of 20 years, from 1992 to 2012, there were 50,000 degrees at the undergraduate level in public health conferred in the United States. But the majority of those, greater than 50%, were conferred after 2008, so in the last 4 years of this 20-year period, which congrues very closely with my awareness as someone who was on the job market of seeing more and more programs hiring faculty who could teach in an undergraduate public health context. There is a lot of diversity, though, in terms of these programs, in terms of how large they are, with a number of them actually graduating fewer than 10 graduates per year, and several graduating more than 100 graduates per year. In their articulations with public health schools, because some are formally housed within schools of public health or have formal affiliations with the School of Public Health in their university, and others are standalone baccalaureate programs that do not have that further framework with a public health school, and the way in which they frame the program, because some are cast as explicitly community health programs or global health programs, or even very broadly as programs in health science that have a very public health foundation. So I'd like to speak briefly about 2 different settings in which I have applied my work as an evolutionary scientist in training students that are going to go on, hopefully, to assorted different career paths in public health ultimately. Both at Mercer University, a liberal arts college in a small city in Georgia, and at Boston University, a Research One environment in a pre-professional school in the urban Northeast. I feel that there are lots of opportunities that the interdisciplinarity of a liberal arts context can add to the sheer interdisciplinarity of public health as a field, and that evolutionary medicine has a core role to play in that. So for example, when I was at Mercer University, I designed an outbreak investigation simulation for my class where I introduced a novel virus, did not explain to the class what it was, and had them track over the course of a week infections both in space and somewhat virtually that I simulated for them, and brought in my colleagues in biology and in chemistry to use their expert knowledge to model parts of this to my class, which then springboarded us into a discussion of the evolution of virulence and ways in which understanding both host pathogen coevolution and understanding the ways in which social networks matter in modeling real-life disease spread can be enhanced by this evolutionary understanding of disease. Furthermore, at Boston University, I've found that one of my biggest challenges in a very pre-professional setting is the question, will this be on the exam? Because so many of my students are pre-med students who are under a lot of pressure and want to make sure, because pre-med students, as we've already heard in this session, are very goal-oriented, that this information will have real utility to them. To which I respond, yes, this will be on your exam in a very applied format. It's going to ask you to use the framework of evolutionary thinking to unpack this health problem or to chart a specific solution to this health problem. But furthermore, it'll be useful for you in your profession moving forward to help make sense of all of these perhaps disparate facts that you learn in medical school, all these different systems that you learn about, to integrate them and pull them together in a way that articulates and fully works within a path, within a system with itself. I wanted to look furthermore at whether accreditation could become or is a barrier for undergraduate programs in public health. Undergraduate programs in public health are not required to become accredited, but there is a voluntary accreditation that they can undergo, either as part of a larger school of public health or, as of 2013, as part of a standalone accreditation process for standalone baccalaureate programs. And within that, there is actually an explicit requirement in the accreditation guidelines that the public health major must have a curriculum that addresses the underlying science of human health and disease, including opportunities for promoting and protecting health across the life course. And I would argue that evolutionary medicine provides exactly and precisely that. There's a framework, if this will go, that will go. There is a framework that the Association of Schools and Programs in Public Health has outlined for undergraduate learning outcomes modules, and in particular, the 4th quadrant of this for integrative and applied learning is directly applicable to these evolutionary ways of thinking. There are 20-odd different examples of ways in which professors in public health can model this on the website, none of which currently provides an evolutionary example, but I counted through them, and at least 5 or 6 of them could easily be placed by an evolutionary example that someone in this room could hypothetically make and write and volunteer if we have connections in public health to leverage that volunteering into perhaps appearing in a future revision or iteration. So I'd argue that we all can contribute to the inclusion of evolutionary teaching in baccalaureate public health programs, from having senior faculty in their mentoring include the suggestion that their students could go on to seek out a career in this way, from junior faculty incorporating it in their own teaching and engagement with the baccalaureate program from their campus, and for graduate students to consider that as an option as well. And I believe I am out of time. Thank you.